So if a facility is interested in opening up a restaurant or other types of food service facility in our city, the first step is submitting a plan. And the plan has to include things like their source of food. Where will they be getting food? Do they have adequate amount of seating? Do they have adequate amount of food storage, hot and dry, cold storage? How often will they be receiving shipments from shipping companies per week? Do they have sufficient amount of space? Each facility must have a certified food protection manager, and there are different options for them to take these tests. For example, take a class and then a test to ensure that they understand food safety. We review that. We review their menu, their process in preparing each of the foods to ensure that they're a safe method. And then once we approve it, as well as other agencies in town, such as building inspections and the fire department has to approve it, then they can go and obtain a license. There are different licensures, risk levels. You can have a risk level 1, risk level 2, or risk level 3 food service facility in Grand Forks. Risk level 3 means you have higher risk, more prone for foodborne outbreak, and they have more inspections per year than does, say, a risk level 1, for example. And after that has been approved, then they can go and obtain their license, and then we go about doing standard inspections. Inspections cover a lot of things. They cover making sure they're washing their hands, they're using gloves when they need to, using hair restraints, or using masks if the facility requires them to wear masks. Make sure they're using proper cutting boards and washing their dishes at the proper temperatures, at the proper frequencies, making sure it's the behaviors. We do those inspections, and then if the inspection is fine, we submit a form to the facility, and then that's public information too. So you can go on the North Dakota Department of Health website to obtain a copy of those food service inspections and the sealed documentations we had made from those inspections. Depends on the risk level. So if they're a higher risk level, and risk level is really what types of foods are they serving, what's their processes involved. They would be a risk level 3, and they would be inspected 3 times per year minimum. Risk level 2 would be just preparing, but not reheating or anything like that, cooling and reheating. And a risk level 1 would be standard, maybe a gas station, maybe a convenience store. We also inspect grocery stores. Schools are inspected all the time, even high-risk facilities like nursing homes, hospitals, we're inspecting those too. Inspections can be conducted at any time we like to. We like to really kind of do diversity in times to see them when they're preparing foods, maybe early in the morning, when they're in their peak point at lunch or evening, or in sometimes bars. We're in for inspecting bars, it might be in the later evening we'll do inspections. So no, they're not pre-scheduled unless it's a unique situation. Another thing that we do with restaurant inspections is we reply to anyone who has concerns about any type of what they consider foodborne outbreak, if they had any symptoms after eating at the facility, symptoms meaning vomiting, diarrhea, fever. And then we follow up with them, check what their symptoms were, backtrack on what they'd eaten in the last 48 to 72 hours, and then follow up with the restaurant or food service facility that they'd eaten at to ensure that they're still doing it safely.